where women have different types of health issues and challenges they are facing. First of all, when we talk about health, so according to WHO, refers to the health of women which differs from that of men in many unique ways. Women's health is an example of population health, where health is defined by the World Health Organization as a state of complete physical, mental, and social well being. When we talk about health, we will consider all about these three issues or targets, especially physical health, mental health, and social well being. This is a collection of any type of health or any uh, individual's health, often treated as simply women's. Sometimes we usually mostly talk about the reproductive health, especially in females. And nowadays we are talking too much about SDGs, Sustainable Development Goals. And according to SDG 3, ensure healthy lives and promote well-being for all at all ages. This is the main purpose or main cause of the SD3G, where we want complete health for all genders and without any gap of ages. And our target is that, and our target by 2030, reduce the global maternal mortality ratio to less than 70% 10,000 live births, and ensure universal access to sexual and reproductive healthcare services, including for family planning, information and education, and the integration of productive health into national strategies and programs. These are the main goals of SDGs regarding health, especially in women. Okay, every woman, every child. For healthy and empowered women, children, and adolescents. When our women get healthy and safe, our children will also do. Okay, this is the same. This is the some points regarding women health. When we talk about rural and urban women's, this is a same same points they are facing, like a different type of sexual functions, different type of fertility management, different and various types of mental health issues, promoting health and well-being. Many women have different UTI infections, breast health awareness. These all types of issues they are facing, even although they live in urban or they live in our rural areas. Okay, when we talk about women health, especially in rural areas, so where they are facing different health issues from warm to torn. Women's health issues is starting from their adolescence to their mature age. And these are the some special diseases they are facing from their childhood, adolescent, or then older ages. In childhood, they are facing different sex selection, abortion, female malnutrition, different types of nutrition problems. And then we go in adolescent or adult age, they are facing unwanted pregnancies, different types of sexually transmitted diseases, sexual harassment. This is very common in nowadays, especially in our villages, or I can say in urban areas too. Different types of smoking and substance abuses. And when they go in older ages, they can different types of health issues like osteoporosis, different types of bone issues, different types of heart heart issues, and increase in morbidity problems on quality of life. These are about the women's health from warm to dawn. Okay, now we will go in different phases, or we can say life cycle of women and health issues. When they are in their infancy stage, or like their childhood, means 0 to 9 years ages. Different sex selection means many um, I can say in this era, many people prefer male child rather than female child. In many villages and different types of rural areas, especially in our urban areas, we have seen these different types of cases where sex selection is very much common, and then different types of genital mutilation, discriminating nutrition. Then in their senses, male required more nutrition, more healthy diet rather than female, because male is more strong, or they are the supporting power of the family. So they have to get more nutrition and more fruitful diets. And after that, discriminating healthcare. This is the main issue. And both rates and the causes of death are similar for boys and girls during infancy and childhood in different rural areas. Prematurity, birth, asphyxia, and infections are the main causes of death during the first month of life. Premature babies are very common in our rural areas due to malnutrition of pregnant females. They don't have enough diet or enough healthy diet to bear this pregnancy period. So if mother is a man having malnutrition and don't have a proper diet, so baby is also don't get the proper diet, and the result is premature babies, which is the time of life when the risk of death is the highest. Pneumonia, prematurity, birth, asphyxia, and diarrhea are the main causes of death during the first 5 years of life due to very unhygienic condition, due to malnutrition, due to unhealthy diet. These are the main factors of this different types of diseases like pneumonia, prematurity, and diarrhea. Diarrhea basically is a gastro disease, and in our rural areas, people is still drinking is not a very clean water. They are still drinking is a very dirty and very much polluted water. Malnutrition is a major contributing factor in 45% of deaths in children aged less than 5 years. Malnutrition is a very common factor in our rural areas, and these are all premature babies due to different types of reason, due to different types of factors, including malnutrition, different types of water and food pollution, and contamination, different types of mental stress, different types of diseases. So this is the result. Okay, when age is going, and then they go into the adolescence age, means 10 to 15 years, and they face early childbearing and abortion. This is also a very common factor in our rural areas, according to Women Health. Every early childbearing and abortion. When any female get this early childbearing, they don't have enough energy. They don't have enough um, power to get deliver any child, even physically, even mentally, both. And other than the different side, they also have different types of sexually transmitted diseases, and then HIV infection. HIV infection and sexually transmitted diseases is a very common cause of death in our rural areas in women's, especially in women's, because they don't have any types of basic, even a basic awareness to prevent this type of sexually transmitted diseases and different types of immunocompromised diseases like HIV, AIDS, cancer. They don't have any idea to how to cope up with these diseases and how they can prevent themselves to them to these types of many lethal or I can say many uh, infectious diseases, undernutrition and anemia. When they don't have enough diet and and especially don't have a healthy diet and don't have the awareness to how to get the proper diet or so they can get anemic or anemic patient. Increased substance abuse. This is also as main or can say major factor of the women's health in rural areas. Okay. When we talk about the 10 to 19 years ages of women, mental health and injuries, self-implicated injuries, road traffic injuries, and drowning are among the main causes of death worldwide in adolescent girls. Disorder and in adolescents aged 15 to 19 years, schizophrenia are leading cause of ill health. Schizophrenia is basically a mental disorder. And in our rural areas, especially 15 to 19 years ages women facing these types of mental health disorder and different mental mental diseases, HIV and AIDS, like as I say earlier, different types of immunocompromised and immunodeficiency diseases. In 2011, about 820,000 women and men ages 15 to 24 were newly infected with HIV in low and middle income countries. More than 60% of them were women because lack of awareness, because different types of our taboos situation. Because in our society, women cannot discuss these types of diseases. They also hide. They always hide these types of diseases. Society, uh, uh, mm, what does the society matter, and then different types of family ethics and our individual ethics. So women don't have any right to discuss these types of issues. So when they don't discuss with anyone or their healthcare facilitator, so diseases is increased and eventually they can die. Globally, adolescent girls and young women are twice as likely to be at risk of HIV infection compared to boys and young men in the same age group. This higher risk of HIV is associated with unsafe and often unwanted and forced sexual activity. This is also a main reason of this types of very much HIV and AIDS in our different rural areas, unsafe and often unwanted. Okay. Early childbearing increases risk of both mother and their newborns, and especially if mother is malnutrition, they don't have a healthy diet, they don't have healthy environment, they don't have healthy mindset. So mother is a very much in stressful condition, and simultaneously the newborn will adopt all these negative factors, and then also they will mm, don't survive. Progress has been made in reducing the birth rate among adolescents. More than 15 million of the 135 populated million live births worldwide are among girls aged 15 to 19 years. Pregnant adolescents are more likely than adults to have unsafe abortions. An estimated 3 million unsafe abortions occur globally every year among girls aged 15 to 19 years. Unsafe abortion contributes substantially to lasting health problems and maternal deaths. Complications from pregnancies and childbirth are an important cause of death among girls aged 15 to 19 in low and middle income countries. Complications occur where different types of factors are present. Not even physical factors are also mentally, and different psychological factors are also involved. Okay, when we talk about the reproductive age, 20 to 44 years. In this age, women have different types of unwanted, unplanned pregnancies. Means that one women have more than 5, 6, 7, 8 or number of children, and then they go for abortions, different types of sexually transmitted diseases and AIDS, pregnancies, complications, and anemia. When the women have a different types of issues like mental issues, physical issues, how they bear different uh, many pregnancies if they don't have any proper diet, if they don't have any proper aware, awareness to how to develop their bodies to uh, grow more and more to bear pregnancies in different times of period. So they get abortions. Maternal deaths are the second biggest killer of women of reproductive age. And why does this occur? Due to non-awareness conditions. People use different types of, I can say, fake doctors or healthcare providers. They don't have different um, specialized equipment to operate themselves. So, if the environment is unhealthy or the environment is not sterile, the maternal deaths will also increase. Every year, approximately 27,000 women die due to complications in pregnancy and childbirth. 99% of them are in developing countries. Despite the increase in contraceptive use over the past 30 years, many women in all regions still do not have access to modern contraceptive methods. For example, in suburban Africa, 1 in 4 women who wish to delay or stop childbearing doesn't use any family planning method, or they don't have any awareness regarding this. Tuberculosis is also a very important factor or disease in our rural areas, especially in women. Tuberculosis is often linked to HIV infection and is among the 5 leading cause of death in low-income countries, especially in Pakistan, among women of reproductive age and among adult women aged 20 to 55 years. And tuberculosis is spreading very fast just due to non-awareness condition. People do not have awareness about this, how to cope up the tuberculosis patient, how to manage them, how to control tuberculosis in their society or in their areas, or how to prevent them, to control TB, or prevent their family members and their self also, and especially TB treatment. People do not have enough awareness regarding treatment of TB. Nowadays, TB is 100% treatable disease, but people do not have awareness to how to cope up with TB, how to contact with different TB healthcare providers to get treatment, to get proper and complete treatment. In TB, it's very much necessary or mandatory to get complete treatment to eradicate the TB from root. This is the very alarming situation in nowadays, that in our rural areas, TB and different types of immunocompromised diseases like HIV/AIDS are spreading. Is a speed of bullet, we can say. Now, injuries. Injuries, both self-inflicted injuries and road injuries, figure among the top 10 causes of death among adult women 20 to 59 years globally. Both self-inflicted injuries and road injuries. In the WHO Southeast Asia region, burns are among the top 10 leading causes of death among women aged 15 to 44 age. Women suffer significantly more fire-related injuries and death rather than men due to cooking accidents or the results of intimate partner or family violence. This is also a major issue in our rural areas, especially for women. Why always women burn? This is a thinkable question. Women, especially when we talk about our rural areas, women burn during cooking. Women burn during any type of family violence. Always women bear this burning. This is a very thinkable question. Okay, cervical cancer. Cervical cancer is the second most common type of cancer in women worldwide, especially in our rural areas in third world countries, with all cases linked to a sexually transmitted genital infection with the human papillomavirus. Due to poor access to screening and treatment services, more than 90% of deaths occur in women living in low and middle income countries. And why the poor access of to screening and treatment? Because because the discussing about cervical cancer is also a taboo. Women never discuss these types of issues, even not in their family members, not with their mothers, not with their healthcare providers, not their physicians, because of shame. I never understand. Disease is a disease. Why are we ashamed to discuss different types of diseases? Disease never have any gender or age issues. When we talk about breast cancer is a both gender issue, male and female. But whenever we talk about breast cancer, we always discuss females, and females think this is only their issue. But men also have different breast cancer. I know rather than male, female have more cases, but never hesitate to discuss regarding their diseases, because when we hesitate to discuss, we cannot eliminate or treat the disease timely. Due to poor access to screening and treatment, deaths occur even in male and in females both. Always discuss any type of diseases with their family members, with your physician, with your discuss. They don't discuss their parents, their family members, their friends, because they're ashamed to discuss different types of diseases and different types of issues. And when we don't discuss, they will always depressed. Discussion and counseling is a very much important to avoid our depressive mood or depressive condition. Depression is the leading cause of disease burden of women in both high income and low income middle countries. Every year, an estimated 18,000 people die from suicide globally. The majority begin being men and women also. Okay, disabilities is also a major issue in our rural areas regarding women's health, which affects 50% of the world's population, is more common among women than men. Women with disabilities have poor health outcomes, lower education achievements, less economic participation, and higher rates of poverty than women without disabilities. Because our society have different sides or different scenarios. Nowadays, still in our a very technological era, but disabled people always have some issues regarding our mindset, regarding our our mentality, because we still don't accept these types of disabled people. This is a fact. I know this is a bitter fact, but this is a fact. Women have disability, so they have disabled people also have poor health outcomes, lower education achievements, because they don't have get very much advantages or opportunities to get high education or different types of high achievements. So if they don't get high education or high achievements, less economic participation is occur. Okay, different types of COPD diseases, chronic obstructive pulmonary diseases. Tobacco is a main cause. Tobacco use and the burning of solid fuels for cooking are the primary risk factor for chronic obstruction pulmonary diseases. It's a life-threatening lung disease in women, especially in women where still women don't have gas oven or gas stove and use coal for cooking or different types of kitchen practice. So due to coal practice, due to solid fuels for cooking, they have different types of lung issues. One third of all the COPD deaths are diseases in women caused by exposure to indoor smoke from cooking with open fires or inefficient stoves. Okay, post-productive means when women reach 45 years and above. Different type of gynecological malignancies, cardiovascular diseases, osteoporosis, arthritis, different types of diabetic issues, and then lifetime gender violence, environmental and occupational hazards, depression. And just moving, okay, when we talk about the seven dimension of wellness, we were talking about the different types of issues, and now we are talking about how to cope up with these issues. Seven dimensions of wellness. First one is social, occupational, spiritual, emotional, physical, intellectual, and environmental. These types of seven dimensions of wellness, if any person have these all dimensions, is very well conditioned or in healthy condition, they are a healthy persons. Otherwise, they are not. Health, when we talk about the health promotion in our, especially in our rural areas and in women's, family planning and reproductive life plan is most important. Weight status, physical activity, nutrition intake, folate, means different types of healthy diets, substance or alcohol use, sexually transmitted diseases, depression. These are the health promotions. And what is the health screening? When we talk about the medical facilities or diagnostic facilities, screening is most important. Screening regarding breast cancer, screening about cervical cancer, screening for different types of bone disease like arthritis, osteoporosis to diagnose earlier and then treat well. Bone mineral density test, osteoporosis, breast cancer, cervical cancer. These tests are most important to find out the disease in early stage to treat well. Okay, talk about the prevention, empowering, and what we can do to avoid these types of diseases in our rural areas, especially in women, to prevent them for empowering women with education and employment. This is the main thing. Family planning and sexual counseling to avoid these types of premature babies, these types of different um, uh, gynecological complications or diseases, sex education of young adolescents. They have to know the age to bear a baby, or to bear any pregnancy in a very smart age, or we can say in an ideal age, to cope up all these of complications. And this is also a prevention law. We have to apply the law to defend them, to prevent them these types of unlawful situations. Counseling is the most important thing to avoid different types of psychological elements, different types of physiological elements, because when they have awareness, when they have counseling sessions, they know how to prevent TB, how to prevent breast cancer, how to ignore the cervical cancer, how to ignore the premature babies situation. So counseling is the most important thing. Support services from their family members, from their friends, from their society is a very important thing. When society support anyone, they can get confidence and they can confidence to discuss their diseases and their problems. And when they discuss their half issue is already resolved. Medicare, proper Medicare for vaccination, Medicare for diagnosis, and Medicare for early treatment is most important. Raise awareness, as I said about counseling. Mobilize support, not in a very immobilized or stuck or very I can say structure support. Mo- 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 Mobilized support means they have the different types of healthcare providers. They can go home to home to consult them to get awareness and then discuss their issues. Okay, quality of care where health services are available and affordable needs skilled staff professionals. It is the most important thing. If they have the skilled and professional staffs, healthcare providers, they can get more facilitate to number of people. Effective client provider interactions, adequate supply of drugs. Drug means antibiotics, different types of medicines to treat them well. Communication programs, communication program means awareness session. Information to poor women and family on health problem and importance of seeking care. And what is the intervention? Strengthen the performance of overall health system, especially district level. When we talk about the rural areas, we talk about our district level. We have to move our district level to spread awareness and spread different types of counseling regarding mental, physical, all types of issues. Effective program to promote increased utilization of maternal health services. Maternal health services is most important to avoid early childbirth, early menopause, early different types of pregnancies, complications. Women access to basic and comprehensive emergency obstetric care. Availability of skilled birth attendant is the most important thing because if the birth attendant is not skilled, they don't use sterile equipments, and then different types of vaginal infections, different types of sexually transmitted diseases when occur. Information on maternal morbidity and maternal death audits. These are the interventions and they can apply in our all rural areas to get aware and then prevent them different types of physical and mental disorders. Thank you so much.